Right, active cases of COVID-19 in South Africa continue to rise after the country recorded over 4,000 new infections for a third day. 4,230 new cases to be exact, and that's over the past 24 hours. The positivity rate stands at 16.8%, down from 17.7%. That's in the previous reporting cycle. Active cases have increased to over 26,000. There were 12 new COVID-19 related deaths reported, but only 2 over the past 24 hours. So there's a bit of a backlog there. It does take the death toll to close to 100,300. All right, so fears of a fifth wave of COVID-19 are rising along with these numbers of infections. Just let's recap those figures. 4,230, 12 deaths, but 2 over the past 24 hours. The numbers have topped 4,000 for the past 3 days or so. Now, to put that into context, we were looking at figures well below 1,000 per day just a week ago. So the picture has changed quite dramatically over the past week. To discuss, we're joined by Dr. Nicholas Crisp, who's the Deputy Director General at the Department of Health. Thank you for being with us, Dr. Crisp. How worried are you tonight?
Evening, Francis, and hello to the viewers. So we've been watching this for 3 weeks already, and a gentle rise with a bit of an uptick in the last 14 days or so. We watch geographically down to very small areas where the flames start to show, and we're also watching which variant it is that's responsible for things. So at the moment, we're not overly concerned. This may well be the start of a new, what we commonly refer to as a wave, but it's early days, and so what we need to do is get through the weekend and into midweek before we see whether this trend continues, before we really start to say anything. And I'm sure if there's any particular announcements, then by midweek the minister will make whatever announcements. Today's test positive is 3,222, but of course it is a weekend, and Mondays are also the lag of the Sunday specimen, so we won't really get a good handle on it until Tuesday of what is happening.
Yeah, we often see that in the numbers, a lull on Monday, and then it all hits us on Tuesday or Wednesday. We have over time seen this decoupling of infections versus deaths. So the variants becoming less fatal over time. Apparently this is being driven by Omicron. Is that the good news, that we won't see the death rate going up probably?
Well, that's way too early to say something like that. So first of all, we don't know that this is what we're seeing at the moment is indeed a fifth wave. It's too early for that. What we are seeing is that Omicron is mutating, as the virus has done all the time. It keeps mutating. We've seen reports out of other parts of the world with BA.2, and we do have some sequencing of BA.2 subvariants of Omicron. But we also have BA.4 and BA.5 in South Africa, and the mutations on those subvariants are mutations we've seen before, which have caused increase in transmission and perhaps some infections. What we are seeing in the concentration of the numbers over the last 14 days is that it's very much in the urban areas. It may well be just a spike as a result of people moving around over the Easter weekend. And it may well be driven by some different behavioral characteristics of the BA.4, but it is very early, very small numbers compared with what we had before, even if they're increased quite a bit from what we have seen in the past month or so. We know that Omicron was a less aggressive or less what we call virulent strain or variant of the virus, but remember Delta was very aggressive. So I think for now, what we really would like to emphasize is that believing that you have immunity from wild infection is not a smart move at all. You need to have been repeatedly infected or repeatedly exposed to a vaccine to get a good immune response. You don't need only antibodies. You also need a cellular response. And to do that, your body needs the memory of repeated exposures. So please go and get vaccinated. We have plenty vaccine, plenty capabilities to vaccinate you, and the staff are looking forward to seeing you there.
I think I spoke to a colleague of yours when we saw some of the vaccines expiring and sadly they had not been used. She said, if I'm correct, that we're going to see a very big batch of vaccines expiring in June or July. So is the clock ticking really to use those right now?
Yeah, so we've made public announcements about that. And we've given warnings about it already. Remember, we got 7.5 million doses of vaccine donated by the United States when we ran into problems with Johnson & Johnson globally, when they had the problem with the infection in their Baltimore plant. And so we got a large donation at that time. So it's more or less that amount of vaccine that is sitting with the vulnerability of potential expiry in June, July, and August. So the vaccines were delivered with somewhere between 7 and 9 months of shelf life. Well, we call it shelf life, but fridge life at -70, and the clock wears down on that. So if we don't use it, you can't prolong its lifespan once it's past its expiry date. So obviously we would like to use it, even if it's the equivalent of donated doses.
So millions are expiring June, July, August. So you're helping your country, I guess, and yourself if you go and get your booster or your second vaccine or whatever you need right now.
Yeah, you're also thanking the taxpayer in America who paid for all of this vaccine. So, this is a donation. It's really hard to tell a donor, thank you very much, but we've had to dump all your vaccine because our people didn't think it was necessary to get protected. And that will be a crying shame if, in fact, we do get an aggressive wave and even more waves which may come, and people could have protected themselves. So one doesn't wait until you're in a battle to start arming yourself. You arm yourself before you get in that situation. And it's easy to arm yourself by getting vaccinated now.
What happens, I mean, with the spectre, the potential of a fifth wave? You said this may not be the beginning of that. There are concerns not only about health, but the economy again. There's been a lot of objections to the regulations that have been moved over. It looks like level 1 basically moving over to the health department. What is happening with that? Because after the 30 days after the state of disaster falls away, then apparently we have no legislation unless that comes into place.
Yeah, so let's try and get it in perspective. Today is the last day for the comments. The minister extended the date to today. So by the cutoff of the working day, because I'm afraid weekends are working days for most of us at the moment, we now have cut off the comments. There are many, many comments. Some of them are very short, we don't like or we do like, but there are some very good substantive comments. So we have a big team that is looking at them, and we have legal support to assist us to wade through the implications of what's there. So the effect is that just because you have a regulation does not mean you have to use it. It means it's a tool that's available to you if you need to use it. Now, in the case of the Health Act, we have to give warning when we want to change a regulation or when the minister wants to bring out a regulation, whereas with the there is an escape clause which allows the minister without notice just to implement, but one would really shy away from doing that. And that was what the Disaster Management Act allowed, was to act very quickly and to bring regulations in basically immediately. So there's no guarantee that whatever the next wave does is going to create havoc. If it does, and we're all in mortal danger again, there will be a need to bring in some form of restrictions of movement and so on. But at this stage, it doesn't look like that's what we don't anticipate that. We do anticipate that there may be flare-ups and there may be localized need to contain the spread of the virus through maybe movements at a far more local level. And that's what one's trying to do. But I think let's give the regulation drafting a chance. There's been very good public participation and input on that process. In the meantime, we as citizens need to take responsibility for our health. What we do impacts on the people around us, not only on our own health. And if we are living in a family or in a group of people, if we get sick, our sickness impacts on those around us. So the plea is protect yourself, because you're not only preventing yourself from getting sick and perhaps mortally sick, but you are helping those around you if you get properly protected.
And hopefully everybody's listening. So yes, Dr. Crisp, but just to get back to my question, please clarify the timeline here. The state of disaster was ended by the president in relation to COVID-19, I think on the 4th of April. So that means by the 4th of May, level 1, those sort of regulations that were still in place for one extra month because the law allows for them to be in place, come to an end. So what if there's still wrangling over the health regulations? Does that mean there really is no legal tool to enforce anything?
That is what that would mean. So obviously there's pressure on the health department to act prior to midnight on the 4th of May. But should we not have regulations in place by then, there will be a vacuum, or a lacuna as the legal people call it, which will mean that there isn't a way to implement any of those restrictions.
All right. Well, we'll follow the process to now deal with those public comments. Thank you very much, Dr. Nicholas Crisp, the Deputy Director General of the Department of Health.